Ellen K. Arenga, and today I will be demonstrating to you on how we do the oxygen administration. First, before we start administering the oxygen, we need to make sure that we wash our hands, mask, and we wear our surgical gloves. This is to prevent from germs in spreading. Now we will be wearing our surgical mask. Now that we are ready, we need to review the chart that the physician ordered for the oxygen to ensure that it includes the method of delivery, such as the flow rate, the filtration order, and the identity of the client. This is to prevent the potential error. We need to identify our client and proceed with the 5 rights of medication administration. We need to explain the procedure to our client, explain to the client that the oxygen will ease discomfort, and inform the client concerning the safety procedure associated with the oxygen use. We need to encourage him or her to breathe through their nose. Is for the oxygen, because oxygen is a drug, and administering using the 5 right Oxygen is a drug, and administering using the 5 right avoids the potential error, and teaching helps ensure the compliance with the therapy. We need to assess our client to semi or high Fowler position if tolerated. This position facilitates optimal lung expansion. So we will help our client, and then we will insert the flow meter into the wall. This is an oxygen in high concentration can be drying to the mucus. Insert the flow meter into the wall. We need to attach the oxygen tubing to the nozzle of the flow meter. If using a high oxygen flow, attach the oxygen tubing to the humidifier. Oxygen in high concentration can be drying to the mucosa. So let's assume that these are the equipment that we will be needing. It has been already attached. Next, we need to turn on the oxygen at the prescribed rate. We need to check the oxygen in flowing through the tubing. This is for us to ensure that oxygen must be administered as prescribed. So let's assume that this is the cannula. So first we will turn on, and then we will test the ensure that the oxygen is flowing through the tubing. So we will test it on our skin, and then we will hold the nasal cannula in a proper position with prongs curving downward. So we will hold it this way, and then rub the tubing over and behind the ears. We can place a gauge at the ear beneath the tubing as necessary. This is for the proper placement of the nares, ensure the accurate administration. Please note that the cannula permits one freedom of movement and does not interfere with the client's ability to eat and talk. Is the prong dislodged from the nair, replace it promptly. This is to ensure that the oxygen is delivered and prevent hypoxia. We also need to assess the proper functioning of the equipment and observe the client's initial response to the therapy. By doing that, we need to assess the vital signs, the oxygen saturation, the color, the breathing pattern, and the orientations, which help us as the caregiver and nurses evaluate the effectiveness of the therapy and detect the clinical evidence of hypoxia. Lastly, we need to monitor continuously by assessing for the pressure area on the skin and nerves every 2 hours and rechecking the flow rate every 4 to 8 hours. This permits an early detection of skin breakdown and adequate flow rate. So now, once we're done with the cannula, we will be using the mask type of oxygen. Now that we're done administering oxygen via the cannula, we will be doing another administering of oxygen via mask. So we will attach all the equipment needed for the mask. So this is the mask. We will attach it. Oxygen mask should cover the nose and the mouth. So this is how we do it. This garter is used to adjust the mask from our patient's face. So once it has been already placed properly, we'll put the garter around the head. And let's make sure that our patient is comfortable. We will adjust the metal rim over the nose and contour the mask to the face. So, we need to assess for proper functioning of the equipment and observe the client's initial response. We need to continue monitor the therapy for the pressure area of the skin and nerves every 2 hours and rechecking it every 4 to 8 hours. Once we're done administering the oxygen, we need to remove our surgical gloves and wash our hands.